Hello friends, I am here with Naomi and Matthew and everybody else. I wanted to do a little update on just everything. I finally had the chance to kind of do something with my hair a little bit because my arm movement is like getting better and better. On Friday, they took out the surgical oncologist. He took out the remainder of the staples. So there were 15 metal staples. No, he took them out, put some skin glue under the armpit, like the strips, steri strips, I think. They fell out, and there was like one left, and he's kind of yanked it off. I was just kind of scared to take it off, but he got it. And the big question is, or the big answer is that there's still no results from pathology. He called pathology, he asked them, so that it's been, like over 2 weeks now, 2 weeks and 2 days, Friday to Friday, and now Monday. But the surgical oncologist said just because there's no results, it doesn't mean it's good or bad. You just kind of have to just wait a little bit. So that's what I'm doing. This morning I went to see my high-risk pregnancy doctor. Hi, Naomi. Oh, you got something over there. Okay. So high-risk pregnancy doctor. Okay. Remember what you gotta do? You gotta go wipe your mouth, okay?
Why?
And then you could be in the video. You just gotta go wipe your mouth. High-risk pregnancy doctor in the morning, and they did the anatomy ultrasound because it's already 19 weeks pregnant. 19 weeks feeling it. Even though I have been like gaining a lot less weight than usual, I still gained a few pounds. I think, and also my blood pressure would be like normal to a little bit higher, but now, even though it was like upstairs, the doctor's office, and I was like, I thought my blood pressure was gonna be pretty high, but it was actually like not low, but on the lower end of normal. So that's interesting, and maybe that's because like I'm eating differently this time around. I'm not eating like processed stuff. I'm eating, I like to say keto plus other things, but really, like I think I mentioned when they did my blood work, I'm not in ketosis at all. My glucose levels are normal. Also, interestingly, is that usually with my pregnancies, I have anemia, but blood work showed that all my iron levels, everything looks very good. And my primary care physician's like, oh, it looks like very good. Normally, or a lot of the times women, when they're pregnant, their levels are lower, or like they tend to be more anemic. And I was like, oh, is that something I should worry about? Not being low. But he said that's all good. We kind of laughed about that. So yeah, let's see, the baby looks, I have a couple of notes just so I'm not stalling too much. From the high-risk pregnancy doctor, the ultrasound, they said the baby looks good. All my fluid, all my everything looks good. The baby's actually measuring 1 week ahead. And I guess the concern they have with like surgery and all sorts of stuff is that the baby's not going to be gaining weight as the baby usually would. But in my case, it seems like the baby's doing just fine. And both Bogdan and I, my husband and I, we're bigger people, pretty tall. I'm 5'8", he's like 6'1" or 6'2". So all of our babies are usually reflective of that. So yeah, the baby looks great. The doctor did say that because there are no pathology results yet, we're gonna have to do this anatomy scan thing again in about, hi Naomi.
Hi.
In about 5 weeks.
Mama, can I go like this?
Like what?
Like this. Isn't my face clean?
Yes, your face is clean. You wanna smile?
Yeah.
You can smile and say hello.
Hi.
Hi. How old are you?
59.
You're 59? You look great for a 59-year-old. You look very good.
Why?
You're 4, yes.
I'm still gonna be
Ooh,
fine.
Names, could be careful with my
I'm
arm.
still gonna be fine.
Yeah, when's your birthday? Do you remember?
March.
Close.
May 28th.
Yes, May 28th.
I love mommy.
And I love Naomi. Be careful with my arm.
Okay.
It's like all the time I have to be like cautious. And yesterday at church, a few people were like, "Hey, how are you?" And I'm just like, "I'm good." So I feel like even though I don't need the sling anymore, I feel like I should still wear it just so people know not to touch it. Okay, Naomi, hold on.
I want to sit.
You want to sit with me? Okay, sit with me for a little bit, but I really want to... Okay, so let's see. What are we doing now? Let's see. So I have to do the exam again in 5 weeks. And because the whole point is that they want to see what my baseline is if I need to start any treatment, but without knowing my staging, without knowing where I'm at, they can't do treatment. They can't do the baseline. So they'll have to revisit the baseline when we know what it is. Now, are we finding out if it's a boy or a girl, Naomi, in my belly?
I want it to be a girl.
You want it to be a girl?
And stay 59 years old.
Okay, Naomi,
I should get a sister and a week soon.
Okay, so she wants a sister. But we're not finding out the gender. It's the 4th. We're stoked to have a 4th. Now, more and more, I'm getting excited. And Lord willing, hold on, Naomi. Lord willing, you know, this is gonna happen. The baby's gonna be there. Gonna be born. But we decided to kind of not find out gender. A couple of people, including my husband.
Matthew said that he has bees.
Yes. We'll talk about the bees later. And so. Yeah, so we'll just find out the gender the good old-fashioned way at birth. Here, Naomi, why don't you sit right here? Opa. Opa.
Why?
Just so you're not... See? Look, yogurt everywhere, okay? Okay, there you go. We'll make another video, I promise.
Bees are gonna come in and drink
bees.
these.
Ooh, you gotta be careful of that. So, let's see. Sorry, this is even the notes, it's a little longer than I thought it was gonna be. So yeah, the gender we'll just find out later on. And it also, like, a part of it is the fact that, like, I'm like, oh, here, Naomi, you're being loud, okay? Let's go over there. The fact is, like, oh, I'm pretty sure I'll have this baby, Lord willing. The ultrasounds, everything looks fine. But I'm like, there is that chance that something might go south. Or maybe not, you know. I don't want to say I'm a pessimist, but I definitely want to be realistic with all these things. And actually, after our 3rd daughter, Alea, our 3rd child, we gave all of our baby stuff away because we thought, you know, we're good. Not like we're good, but like I already was having like some issues. And I a few years ago I posted a video on something that I had, which was pregnancy acquired hemophilia, which is like a blood clotting thing. You could just kind of scroll down the YouTube channel uploads, you'll see the video. So yeah, I was just like, okay, 3 kids, even, you know, so that, but you know, the Lord knows. And here we are. So we gave all of our baby stuff away. We were like all clear and clean. And so now I'm just gonna wait until probably, like, because the baby's due early September, so I'm probably gonna wait until at least like August to then like get baby stuff. And there's so much baby stuff that's like was given to us, that we gave to others, that people are giving to each other. So my plan is just to, you know, for the essentials, just to pick them up and as people are giving them away. And you know, it's like with the first, you want everything by the book, and with, you know, later on you're like, I didn't really need all these super fancy baby items. I just need, you know, these specific things. So I'll just wait until then. Let's see. Yeah, everything is going pretty good. And in my notes I wanted to make a note. It's not really flowing into it, but I'll still say it that. So right now, like, I'm not working. I quit my job roughly 2 years ago. So after our last child was born, 2 years ago, Alea, we, after maternity leave, I quit my job and I've been stay-at-home mom ever since. Oh, and then I don't wear a ring right now because I am scared that my engagement ring, my wedding ring, because I'm scared that my fingers are gonna expand, and I really don't want to have to like take them off. I didn't know, somebody made a comment before. They're like, oh, like it bothers me when people don't wear their wedding things because it's like, why aren't they wearing them? But it's funny, like I mentioned, like I come from a conservative background, so I remember like the first couple of times seeing like men on the pulpit preaching with a wedding ring. It was like a big like thing for me to get over mentally, because I was used to nobody wears any jewelry type of thing, you know. But anyway, no, but all that to say, I'm pretty sure people know that, hey, I am not on the market. If that's the concern for no ring, I don't know, that's just somebody made a comment. So anyway, so people who have not had babies here in the States, you might be shocked to find out that the leave here is not great, because talking to my Russian, Ukrainian, European friends that have given birth in those countries, you get very generous, you know, years of leave type of thing. But here you only get 4 weeks before the baby comes and 6 weeks after. Hey, sorry. It's just so awkward doing this. Anyway, so yeah, 4 weeks before and 6 weeks after. And the 4 weeks, if you, let's say your baby comes earlier, then that 4 weeks that you thought, like let's say your due date is the 1st of whatever, but if your baby comes earlier than that, then it eats away into that 4 weeks. You don't get to like carry those 4 weeks over, so it's like if you don't use them, you lose them. So 4 weeks prior to a due date, you can take off with, some people don't get any pay at all, nothing's guaranteed, and then 6 weeks, yeah, not months, 6 weeks after giving birth, or 8 weeks if you have like a cesarean delivery, C-section. And I was kind of surprised because when I had my first kid, like almost 7 years ago, I was working for the state, and it also depends like what bargaining unit. I was like in the professional scientist, like energy specialist type of thing, professional scientist. And over there you just get like $135 per week, so 4 weeks plus 6 weeks, and then they take out all sorts of fees and taxes. So you really have to rely on your partner, on your spouse, bringing in some money or on savings. And it totally sucks for people who don't have that cushion or who are single parents, again, without that financial cushion. Because I was shocked. I was like, what do you mean 4 weeks and 6 weeks? And then there is some like unpaid leave, but even then that's like not guaranteed, so just be aware. But again, this time around I'm not working, so I don't have to do any of that maternity leave paperwork or trying to figure any of that out. Let's see, so today's Monday, yesterday was Sunday, and so my 2-year-old lately, she like refuses to go to nursery. She's just being super attached, and she loved nursery. She'd be like, bye mama, mwah, you know, bye. But now she's just like, no, I don't want to go for some reason. I think like developmental something, you know, just realizes, I don't know. Anyway, but it's sweet to have her, but still I had to take her to church, and I took my husband, he was volunteering in Sunday school, so it was just me and my 2-year-old, and then I took my son with me to church too, and we only lasted for like 10 minutes of church because she had snacks, she spilled snacks, she got on the floor, she was making sounds. Whenever the songs would be over, she'd be like, yay, you know, and people like turned around, they thought it was cute, you know, smiling, but still that's not socially acceptable in our circles, you know. I mean, that didn't bother me at all. The fact that she spilled her snacks, I had to pick them up, my son helped me, and then her laying on the floor making sounds, we just had to take her and leave. Live streamed the service, that was good. And so it was just kind of like one of those days. My heart goes out to the parents who keep their kids in church, like especially little ones. It could be difficult for some, you know, to actually like fully be immersed. Oh man. Sorry, we have construction going on and there's a random guy on the roof. I don't know if I should wave hi or not. I'm not gonna edit this because I don't know how to. Or I'm just not gonna learn until maybe later. So anyway, so I'm praying for a smoother baby newborn experience socially later, you know, when the baby's born in September. Just because the first couple of times giving birth, especially the first time, like it was just kind of like rough, you know, postpartum, and then you're feeling like you want to take care of your baby, you don't want to be a distraction for other people in social settings such as church, so you take the kid and you miss out on church, you miss out on groups, you miss out on so much things because, you know, you're thinking about other people. So I'm really hoping that this time around, I mean, it's going to be the fourth time, so hopefully there's going to be more wisdom in that, how to balance being respectful towards others versus allowing others to serve you by letting you be present, even if your baby makes a sound or two when necessary, you know. So it's like both sides are considerate towards one another. Anyway, thank you so much for all your prayers, all your everything. I know some people have been reaching out asking like if there's anything we need, like meals, or even some people like money and stuff. Like, praise the Lord, we're not, you know, God's providing. We're doing a-okay. So if things get really rough, I promise I will really try to like work on like accepting help, because even like a couple of people offered to like come and help clean the house, you know. And to be honest, for the past like so many months, it's been a struggle. It's been especially, you know, first trimester. Now it's second trimester. I mean, besides feeling like nasty sensation and not being able to fully use my arm, like I'm feeling totally fine. So things are different. But like it's still, it's like, yeah, I needed that help, you know, to clean. And I sincerely appreciate those people for offering, because I know they were sincere and, you know, we're offering out of like love and all these things. But I just maybe, I don't know, you know, something in you that's like, you feel like, hey, I should be able to wash my own floors even when you're not able to physically. I don't know. So that's something to think about, something to like work on, because it's so much easier and so much more pleasant to like help others, but to be in a position of needing help, and to actually accept it, to actually allow people to see you be all sorts of messed up and help you. Maybe it's like a pride thing, you know, but definitely hoping that I'll never be in a position where we're like super needy for help. But if we are, like praying and even talking to a couple of friends about that, kind of like to keep me accountable, to help me kind of like swallow my pride and admit when I need help. Because I mean, I do have a family, I have a husband, I have kids, and they help so much, they do so much. But there's, you know, sometimes we feel like we're drowning because it's just so difficult to do it all when you feel like you can't, you know. Oh yeah, so I think in a previous video I mentioned that I was gonna like focus on building social relationships with people, like fellowship. And already for the second time I met up with some ladies from our church. Just again, like I put out a invitation to anybody, and this is an invitation to everybody and anybody, Sacramento region. We're like once a month on Saturday just to meet up, and have like fellowship. And this past Saturday, so 2 days ago, we met up, and the host, she suggested we read through the book of Philippians, and it's only like 4 chapters, and it was just such a good rich time. You know, probably a lot of people know the whole passage about be anxious for nothing but in everything, and prayer and supplication, something about with thanksgiving let your requests be known to God, and that like the peace of God will come upon you or whatever. But also like in that same passage it talks about like what you should be meditating on, what you should be thinking about, you know, the whole pure, lovely, honorable, worthy of praise, you know, all these good things, to think about those things and not to just think about whatever comes into your mind, whether, you know, because a lot of the times it's like the scary things, what if this, what if that, or whatever. So that was like such an encouraging time of just like being in the Word, being in prayer, and it was just like 3 of us, but it was super, super, super awesome, super cool. So very, very thankful to God for those moments. Okay, I think I am done with everything that I wanted to say. Again, thank you for your prayers, and I'll put out a video or something when the results come in, and hopefully they come in like sooner than later, because I mean last time it took 5 months to come in, and I'm pretty sure it's not going to take that long. But and I'm actually okay with waiting. I'm not in a hurry, because it's like, what's going to change? I mean, if it's bad results, bad, you know, in terms of I need further treatment, like, you know, things have spread, that's gonna affect me a lot more than if it's like contained for now. Even though I was reading a cancer book, and there was a guy who got a lung transplant from some lady. So he gets the lung transplant, and when you get like organ transplant, they put you like immunosuppressants, so I guess like your body doesn't reject the organ. And anyway, so a little bit of time goes by, he's starting to have like lung issues, so they look at it, and he has a melanoma growth, a tumor in his lungs. And so they did further like digging into the donor, and this lady, the donor lady, she died like unrelated, like car accident or something. They took her lungs, gave it to the guy. But when she was like pretty young, I think like in her 20s, she had like a stage 0 melanoma, which is like you just scrape it off and you're done with it type of thing. But I guess because, you know, they took it off, she's never had a recurrence of melanoma. But I guess the whole point is that her immune system was like keeping it in check. And so versus this guy, when he got his lungs, his immune system was suppressed, so the melanoma growth happened, and he eventually actually died shortly after. So I pray, you know, it's like if I have this melanoma thing in my body, just for my immune system to be able to keep it under control, so that way, you know, nothing crazy happens, and I'm able to just live the rest of my life, whatever God ordained for me. Yeah, and I mean, I think also like with cancer, like what happens, like skin cancer, now I'm like looking at every single mole of mine, and just like, is this potential melanoma, is that? And early next month, I actually have like a full body dermatology appointment, so I'll probably ask about all sorts of moles and have them look. Hopefully everything will be fine. Yeah. Okay, well, thanks for bearing with me or listening to my updates. Thank you for the prayers. Thank you for all the love and support, and it's so appreciated and very inspiring to then be that type of person, you know, to have the eyes and hands and everything ready to help those who are in need, because I mean, some of us are in need now, or some of us will be later. So just to spread that love and attention. Okay. Oh, and then one last thing I just wanted to randomly share. One of the reasons I'm like, I want to do this whole YouTube thing, put out some videos, is because, like, I don't know about you guys, but I have a couple of people in my life that I never really, like, knew fully, but I knew them from, like, a distance, like acquaintances from church, let's say, that have passed. And then I'm always like, man, I wish I knew who they were, what they thought, you know, like, who were they? Like, what was their life like? What were they thinking? What were their passions, you know, concerns? And so I'm like, I want to leave that for anybody that was, like, curious or just wants to remember me if I pass. Hopefully not, but, you know, I mean, we're all gonna pass one day, right? So just to have that kind of thing, because yeah, there was, like, a lady from my old church. She passed from cancer when she was, like, in her, I think, mid-30s, and, like, her husband is now, like, remarried, you know, the whole shebang. Which I'm not saying that anything's wrong with that, because, you know, it's till death do you part. But I just wondered. I'm like, she was always, like, so nice looking, always, like, just kind of quieter, and I don't know. I feel like I don't want to say she's forgotten, because I don't even know her name, to be quite honest. We were never, like, buddies or anything, but still, just to have just to put something out there. Naomi, is there something you want to say? We're ending the video. Do you want to say something?
Yeah.
What would you like to say?
What would I like to say?
Oh, what do you want to say?
I love you, Tita Maria, all of your kids.
You love Tita Maria and you love all the kids? That's so kind. That's a really good thing.